Hi, Ironman athletes. We wanted to talk to you about some important pre-race topics so you can have a safe and awesome race. Number one is heat illness. Heat illness essentially is the body overheating to the point that it causes major problems in the body. And one of the first important things in order to prevent heat illness would be knowing the signs of heat illness. Heat illness is typically characterized by increased thirst and increased sweating at the beginning. And then one of the earliest warning signs could be cramping that is atypical for what you're used to experiencing during normal muscle exhaustion or soreness during the race, followed by increased GI upset. So you get some nausea, and then that can proceed to vomiting, headache. And then eventually when heat illness gets severe, it leads to mental status change or confusion. So we want you to be aware of these symptoms, and certainly if you start to experience any symptoms, that's something to seek medical treatment for during and along the race course. And then the key to treating, the best treatment strategy for heat illness is prevention. We can prevent heat illness by having a good race day plan. You want to really focus on hydration. Hydration with electrolytes can be helpful. And then don't be afraid to change your race day plan. So should you start to experience any symptoms, let someone know. You may need to augment your race by taking increased breaks at transition. You could use ice. And so the most important spots to put ice would be around the head, neck, armpits, groin, and or the chest area. And you can make use of the transition points to do that. And then really make sure that you're fueling and you're hydrating along your bike course, because that's going to be the easiest time to get the most amount of calories and fluids in, as it's more difficult during the running portion. Not only are you more tired, but you're going to have increased body temperature. It's going to be later in the day and your heart rate is going to be more elevated at that time. And then certainly if you really start to get into trouble and you need help or assistance along the course, there will be a University of Maryland physician team along the way. Know where those aid stations are, and we are always here to help you out. We hope you to have the best and safest race, and we wish you the best of luck.